So I specialize in trauma and PTSD as well as assessment, though I do have a general background and work with a variety of concerns coming from individuals, things like anxiety, depression, relationship concerns, emotion regulation difficulties. How to adapt coping strategies, right? Things that used to be helpful for people may not be helpful anymore, and figuring out how to identify that and change it to make it more effective and adaptive for them in their current life and situation. So my approach is integrative. I think at the foundation, at the core of any good therapeutic relationship is the relationship between the client and therapist and building an alliance. And that involves clear, open communication, establishment of treatment goals. And so I think no matter what you're doing, that's a really important base. I would say other important pieces of my work. So I have a trauma specialization. So I do the two kind of gold standard evidence-based treatments for that: prolonged exposure therapy and cognitive processing therapy. I also use DBT approaches more broadly. And then I use pieces from cognitive behavioral therapy as well as psychodynamic tradition as well. What I like about being a therapist is being able to meet someone at a really challenging point in their life and to help them move past that and to kind of gain insight to help improve things and to help people understand that they are capable of that, and to support them in that, of course, and to guide them in that, but having them realize that you're doing the work and you're kind of affecting change in your life. And it's a really beautiful thing to be able to support someone in that. If therapy is something that you're considering, I would encourage you to take the step, take the leap. It's certainly hard to meet someone for the first time and talk about some of the most challenging parts of your life and your experience, but it can also be really liberating and helpful and wonderful to build a relationship with someone who's not connected to your life and who can kind of work with you to make improvements to achieve your treatment goals. And so it can be really hard, but it can be so worth it and so fulfilling to do that.